this is Dr. O here, and thanks for tuning in to Ask Dr. Orbeck. I want to make sure you don't miss a single episode of this show on YouTube, so before we continue, be sure to subscribe to our channel and ring the bell to get notified about our latest videos. If on your phone, just go into the settings and switch on notification. Thanks so much for watching. Hello everyone, and welcome to my monthly live stream, Ask Dr. O. This is where I address common questions that I get from patients at my Regenerative Medical Institute practice here in Greenville, South Carolina. At RMI, I specialize in the areas of metabolic and rejuvenation medicine. I emphasize on sexual wellness, intimacy, regenerative aesthetics. My patients love it, and we have a focus of external beauty through internal wellness. Today we're going to be basically going to discuss some common questions that get related to andropause, otherwise known as male menopause or low testosterone. We will also go over some options for treatment of low testosterone that I provide here at Regenerative Medical Institute. Now remember, you can always visit my website at rmi.live, L-I-V-E, for more information and take a look at what we have to offer. Book a consultation. But for now, let's get started on this week's question. So question number one, does male menopause really exist? Do men actually get menopause? Well, let me just start by saying that most people know that women experience hormone shifts as they approach menopause. Everybody knows that. But many people don't know that men face similar challenges as well. Andropause, which is also known as the male menopause, also causes a decline in your hormone levels that can affect your mood, your energy, your appearance, your vitality, your productivity. All that can happen as well. So like menopause, andropause often begins in the late 40s. Andro causes a drop in your testosterone level, and testosterone is very important in men. Symptoms can vary, and they can become very frustrating. Some men notice only a few changes in their bodies during their 40s and 50s, while others may experience dramatic physical changes. Reduced testosterone can have a major impact on your quality of life. A difference between menopause and andropause is that menopause often happens rapidly. A woman sees changes in her hormones very quickly, mood swings, night sweats, hot flashes. Men's testosterone, however, typically declines gradually beginning in their 30s. And so because it's such a gradual decline, it often goes unnoticed. Also, unlike women, men are unlikely to experience infertility in their 40s and in their 50s. Now, andropause is related to hypogonadism. There are two types of hypogonadism. But hypogonadism is a condition where men experience a reduction in testosterone. The body simply doesn't produce enough testosterone, and it either occurs directly through testicular reduction in testosterone manufacturing, or it can occur also from the brain, either the hypothalamus or the pituitary, not signaling the testicle to develop testosterone. Primary hypogonadism is when the problem originates from the testicle. Secondary hypogonadism is when the problem originates centrally or from the hypothalamus and the pituitary. One thing I'm always cognizant of is that if you're a very aggressive, youthful person as a male and you play basketball, hockey, football, or if you've had any type of brain injury or unconscious injury, that can certainly affect the pituitary gland, which is quite fragile. So these are all the conditions that I look at here at RMI when I look at reduced testosterone in the male population. The most common, however, is primary hypogonadism, where testosterone levels decline because the testicles simply don't have the ability to make enough testosterone under the signal of the brain. So what are some symptoms of low testosterone? Low T can have a profound effect on your mental health. Many patients report irritability, depression, fatigue, memory problems, trouble concentrating, vitality. So this is all very important because free testosterone crosses the blood-brain barrier. Blood-brain barrier is an area of the brain, and it keeps certain things out and it lets certain things in. Free testosterone crosses the blood-brain barrier, letting free testosterone into the brain. The brain then converts free testosterone to dihydrotestosterone, which is then converted to adenyl cyclase. Why am I saying this? Because adenyl cyclase is male's brain fuel. It gives you vitality, ability to remember. It gives you ability to concentrate, to be productive. And so if you're wondering why you're losing productivity, stamina, vitality, this could be the very root of the problem. Now, men experience andropause also may notice changes in their intimate health, body composition. Low T can trigger the following things: erectile dysfunction, low libido, weight gain, especially around the midsection, and muscle loss. Low T can increase your risk of serious health problems. Research has shown a link between low T and obesity. Reduced testosterone levels may also increase your risk of type 2 diabetes, heart attack, cardiovascular disease, and stroke. Keeping your hormones balanced helps protect your heart health and promotes longevity. What are some treatments now, of natural and otherwise, for low T? Let's talk about that for a second. So hormone therapy is very important. I give testosterone in several forms. I have my favorites. There are creams, there are gels, there are injections, there are patches, there are pellets. If I use creams, I don't get as good of an effect because the cream, when the testosterone crosses the skin, it changes to dihydrotestosterone. There's an enzyme that lives in the skin and the hair follicle that changes testosterone to dihydrotestosterone, and DHT, dihydrotestosterone, does not cross the blood-brain barrier. That's why I don't see quite an effect with the creams. Injections work nice, but you have fluctuating testosterone, ebbing and flowing. Pellet therapy is my favorite, simply because when I put a pellet into sub-Q fat, it's surrounded by a capillary bed, which is connected to your heart rate, so you actually do get a pretty good circadian rhythm, pulling off the hormone as your body actually needs it. So if you're struggling from ED, low libido, as a result of your low T, RMI offers other options as well. The first we offer is called the P shot, the Priapus shot. And basically that's taking your blood, spinning out the growth factors out of the blood, and putting them into the penis under a local anesthetic. It's very low pain, pretty much pain-free, and those growth factors help stimulate regenerative tissue within the penis, increasing the function of your ability to get an erection, maintain an erection, and also give you endurance. I also use the Hydromax pump. That is a water pump that I really like. I use it in my practice. It stretches tissue. It helps increase blood flow into the penis. And I have my men who actually get a P shot do that every day. Acoustic pressure wave therapy. I like this a lot. This is called pulse wave or shock wave. And what it does, it puts acoustic pressure waves into the penile shaft, which increases blood flow. It reduces kind of scar tissue, and it helps really increase regenerative tissue within the penile shaft. I use Cell Matrix MD, which is a topical application of a gel. It's basically made of many botanicals, which increase blood flow and the function of both the penis in the male, as well as vaginal health in the female. And then I also use peptide treatments. There are a variety of peptide treatments that I use. Peptides are short amino acid chains. They're very safe. We have lots of peptides in our body, and there are certain peptides that can really help you with your sexual health. Bioidentical hormone therapy is another option, which I offer in my practice at Body Logic MD of Greenville. This process may include pellet therapy, like I talked about earlier. This is a great solution for many patients. Each pellet contains a customized blend of hormones, and it's delivered as a steady dose of testosterone, mimicking your body's natural response that I talked about. Lastly, there are some lifestyle changes that you can make to help keep your hormones balanced. These include the following. Please eat a healthy diet. Stay away from the processed foods. Stay away from the omega-6 fatty acids, saturated fatty acids, high sugar foods. Eat lean and clean. I tell my patients, please eat lean and clean. That means clean protein, lean types of meats, reduced fat, lots of good vegetables and antioxidants. Regular exercise is very important. It helps build muscle mass, it helps increase blood flow, it helps brain activity, So regular exercise releases certain endorphins that certainly help the body and also help balance your hormones. Plenty of sleep is very, very important. If there's one thing in my age management practice that I help my patients try to achieve is adequate amount of sleep. Sleep is when the body goes through restorative properties. Regenerative medicine occurs during sleep. Testosterone production mainly occurs during REM. So getting adequate sleep really, really can help you tremendously. Okay, so as we could close today, are you ready to learn more about your body's hormone levels? Are you ready to help get started on helping you have better vitality, better vigilance, and in sharper brain and sharper mind, as well as a lean body? At Regenerative Medical Institute, I can help you achieve these goals. If you'll schedule a consultation, we'll review your labs, go over your blood and your urine, and we'll outline a treatment plan that is right for you. So I want to thank you for joining me today. I really enjoy talking with you every month, and I wish you a blessed holiday season. You take care. Hi, this is Dr. O here, and thanks for tuning in to Ask Dr. Orbeck. I want to make sure you don't miss a single episode of the show on YouTube, so before we continue, be sure to subscribe to our channel and ring the bell to get notified about our latest videos. If on your phone, just go into the settings and switch on notification. Thanks so much for watching.